Whether you have insurance or not, there is treatment for the illness of addiction. And joining us now are Dr. Rochelle Head Dunham. She's with the Metropolitan Human Services District as the Executive Medical Director. Also, Dr. Ken Roy, Addiction Recovery Resources Incorporated, who also treats at River Oaks. And Ed Carlson, the Odyssey House CEO. And Michelle Gagne-Hamrick, who is a social worker and Executive Director of Clinical Services at Bridge House Grace House. And welcome to all of you. Dr. Rochelle, let's start with you. Your program is funded by grants, federal and state monies.
Correct.
So that allows people to come who don't have insurance?
Absolutely. Our targeted population are people who are indigent, uninsured, or Medicaid eligible specifically. We really don't have capacity, in truth, to treat people who have insurance or can pay out of pocket. So we typically, because of our funding and because we are legislatively enabled with legislation in 2003, created to provide services for that population, they are our priority population.
And Dr. Ken Roy, you treat people who have insurance who come to one of the two places. Tell me how your program works.
Well, we perform detoxification at River Oaks Hospital, but at Addiction Recovery Resources, we have the whole spectrum of treatments for addiction, from ambulatory detox to residential treatment.
In-house. Yours is an outpatient.
It's all community-based outpatient services, that's right.
So no detox
No
type
detox,
thing.
But
Okay.
we do groups, individual therapy. We have every licensed professional in addiction and mental health treatment, because we do addiction, mental illness treatment, as well as intellectual and developmental disability services.
And Odyssey House, how is your program situated?
So Odyssey House, we're one of the largest addiction treatment providers in the state of Louisiana. We treat about 900 people a month on average. We're actually funded partially by Metropolitan Human Services District. We do medically supported detox. We have a short-term 28-day inpatient program. We have a longer-term program combining housing and intensive outpatient services. We also have a medical clinic. We do adolescent residential program. And we also have a large housing, case management, and prevention and HIV programs that we do.
And what about Bridge House Grace House?
Bridge House Grace House provides long-term residential substance abuse treatment program, and our program is 6 to 8 months. And individuals live with us for quite some period of time, because most people that come to us are homeless, indigent, and they have no resources, and their addiction has really taken everything away from them.
And I think we can all talk about that we can always use more in this community,
Absolutely.
correct? Yeah.
Yeah.
More types of treatment. And how hard is it for people to take that first step to come in? Anybody?
It's very, very difficult. It's really tough. And one population that is extremely difficult is pregnant women, and many women, because of the shame of using while they're pregnant. So we really work hard to reduce the stigma of addiction.
And addiction is all across all communities.
Yes.
Right. People that remain in the workplace have a real difficult time because they always have something that they have to do. They always have something that they feel is a priority, and while they're prioritizing all those things, their addiction spirals down and they end up in a worse place than if they had gone to treatment when they first thought it was a good idea.
What first gets them there? Is it a pleading wife, or or children begging their dad? What first gets somebody to come to you?
In 70% of the cases, people have some external coercion, as we say. There's something going on in their lives that is causing them to rethink and get a moment of lucidity where they realize, I need to get some help. But that's not always going to be what keeps them there. It's really important that once they get there, that we do what we need to do to engage them and to keep them connected to treatment over a period of time. And that's not an easy challenge with your battling cravings and desire to use for various reasons, because our population have a number of problems associated with them.
It's so important to grab somebody and get them into treatment when they make that first call.
Yes.
That's just an opportunity, because otherwise you might lose them and never get them back. And we're dealing with a deadly epidemic. People are dying every day. So we do everything at Bridge House Grace House once they make that first call to try to get them in immediately.
And how do you deal with people who go through treatment successful and then repeat because the brain is so addicted?
Same way you deal with people that repeat with diabetes or high blood pressure.
That's right.
Pick up and you treat them. That's what they need. I mean, most people need multiple treatment episodes in order to be successful.
That's right.
We tell all of our clients, look, when you leave, if you relapse, come back. don't stay out there.
Yeah.
And the sooner they come back, the less likely they're going to wind up having as problems as bad as they had. Most people come into our program with barely the shirt on their back.
And you said the city needs to step up more and have treatment.
Well, the city doesn't provide any funding at all for treatment services. And I have been, and we have a whole new administration coming in, and I'm hoping that they can hear this because it's really important. A lot of other cities have started to put money in and services to help to support. And there's a lot of things that we don't get funding for, like case management, job training, housing, things that they could help to provide additional support to our organizations to help people to get back into society.
What's important to understand is that all of the problems that cities have, all of the problems that communities have, are improved by treating people for addiction.
Yeah.
All right, and ladies and gentlemen, we're out of time on that, but your segment is so important because we want to give everyone out there the resources of how to get in touch with you. So we will have all your phone numbers at the end of the show. We'll also have ways to get in touch with you on our website. Thank you so much.
Thank you. Thanks a lot.
Coming up, we've heard about the tragic human toll of opioid addiction, but what about the men and women on the front lines in our community and the cost of our tax dollars being drained from community services? That's next.